Good afternoon, everybody. Thank you so much for joining us here on this rather unique presentation based off some rather unique times. I'm going to just apologize to you right up front. This is going to be a little informal, a little more casual than a lot of presentations that I would do, and it may be won't be as fancy as I typically do with PowerPoint presentations and all that, but we thought it was more important to try to get information to you in the most effective way possible instead of trying to worry about making this any more formal than we need to. I'm also going to have to apologize to you because I'm going to have to be doing a lot of reading, so instead of looking at you like I'd really like to be doing, I may have to be looking down at my notes, but hopefully this will keep me on track and allow me to really cover most of the information that we need to cover today. So again, we appreciate you all being here, and we appreciate your willingness to tolerate this and your patience. So many of you have heard me say over and over and over again, and I never get tired of saying it, and I really hope that you never get tired of hearing it, is that Augusta University, our first and only priority are our patients and our students. That's what drives the entire enterprise. But we know very well we can't be and provide a world-class education for our students, and we can't provide state-of-the-art clinical care for our patients without the most outstanding faculty and staff and caring for those individuals as well. Therefore, the safety of our patients and students and of our faculty and our staff who teach and care for them are obviously our main concern. Therefore, we wanted to hold 2 town halls this week to do a couple of things, to provide opportunities for Augusta University and for our health system community to hear from leadership about the coronavirus, COVID-19 preparations, the situation, and to allow you to ask questions. Now, we had originally scheduled 2 town halls, one that we just had this past Tuesday here in Lee Auditorium, and which it was live and in person, and we had it was streamed and it was recorded, and we had an opportunity for face-to-face opportunities to get information. But we figured in light of the recent guidance from the governor's office and from the University System of Georgia regarding the need at this time for social distancing, that we believe that this live virtual format that you see today is the best venue for today's update. I really want to encourage you to go look at the video. It's on the augustauniversity.edu, augusta.edu, a website. Go to the very top banner and click on COVID-19 resources. You can download that video and see it's got a lot of really great information and information about what the virus is, how we prepare for it, how we deal with it, what it means to us from 2 of literally the world's leading experts in this area, our very own Dr. Keel and Dr. Vasquez. And so we hope that you will find this information informative. So we apologize for having to cancel the in-person Summerville Town Hall, and hope you understand and hope that you'll find this informative. So let me get started. Let me tell you kind of where we are, what the situation is, and how we're dealing with it. At 3:34 p.m. yesterday, I received notice from the University System of Georgia that stated effective Monday, March 16th, all University System of Georgia institutions will temporarily suspend instruction for 2 weeks to allow time for USG institutions to test their business continuity plans and online instruction modules, and for state officials to continue to assess the current situation regarding coronavirus, or COVID-19 as it's now called in Georgia. Students on campus are asked to depart campus by close of business Friday, March 13th, and to remain from campus until March 29th, 2020. At this time, it's important to know we're not asking students to move out of their dorms for the remainder of the semester. Rather, we're asking students to leave and go home for this 2-week period. At 7:29 p.m. yesterday, I received additional guidance from the University System of Georgia based on following further guidance from the governor's office, which has asked us to take immediate action to implement telework options for staff who can telework from home or other locations without interruption to their duties. And when we talk about teleworking, we're also talking about flexible scheduling. We're asking supervisors to implement schedules that will reduce the number of employees physically on campus and to the minimum level required at any given time to sustain service, safety, and compliance. We're asking our staff and our faculty to take advantage of virtual meetings and gatherings, to transition from in-person meetings to an electronic format, or to reschedule in-person meetings for a later time. We're asking to cancel or to move all current, to move to online all current campus gatherings and sponsored events. We've also been directed to suspend non-essential travel for all employees. This includes travel to conferences, particularly those held out of state, training, site visits, and any other non-essential activities. Let me emphasize, when we say a ban on travel, it's on non-essential travel. I'll get to that in just a minute. For those of you who are planning to travel during the upcoming spring break in April, I know you got a lot of questions about what you should or should not do. Please use your judgment regarding travel. We encourage you to go to the CDC website, which has a tremendous amount of information about travel safety and tips and suggestions, and also it's updated very frequently. We do ask you to note that currently, if you plan to travel to level 3 countries, and you can go to the CDC website to know what those level 3 countries are, you may be required to self-quarantine when you return to this country for 14 days before you will be allowed to come to campus. So again, if you have questions about this, if you're unsure about this, go to the CDC website, look at those countries that they're recommending not to travel to, and use your personal judgment as to what you think is best. A lot of our physicians travel across the state. The entire state of Georgia is our campus. And for those physicians who are required to travel to see or treat patients, we ask that you continue to do so, as we certainly deem this as essential travel. The goal here is, to the best of our ability, to limit the number of students, faculty, and staff on our campus during this time, and to encourage what's been now referred to a lot as social distancing. So from my point of view, with regard to these two guidance documents that we just received yesterday, there are two primary issues here. Issues that involve our students and how we deal with our students, and issues that involve our employees. So first, let me talk about students for a minute. I want to talk about coursework in this and the guidance that says we need to cease in-person instruction. In-person instruction is to cease effective this coming Monday, March 16th. I am told that there may very well be classes this Saturday, and we encourage that if there are classes to go ahead and hold those classes as scheduled, but to cease all in-person instruction effective Monday. This pause or this cessation of instruction is to continue until March 29th. During this time, our faculty should begin transforming their in-person instruction to fully online capabilities. Our faculty have already been engaged in determining how best to do this and looking at this. We have had all of our business units looking at business continuity plans in the event that this issue might arise. They've been doing this for several weeks now. So now we're asking our faculty to fully convert your in-person instruction to online. And I will go in a little bit more detail what I mean by online, distance education. Now, if you need help in converting your courses online, and we know that not all faculty have the expertise or the talent or the ability because they've never done it before. We know you're going to need help, and we want to try to provide you with as much help as possible. Please go to www.augusta.edu/continuity. Augusta.edu/continuity. It's a wealth of information there that can help you take your current in-person class and convert it to an online platform. Seek help. Please go to your department chairs, go to your deans. We want to give you as much help as we can to convert this education to online. So at the end of the 2-week period, regardless of what the situation is at that point, we are fully prepared to go online. Now, for those courses that are currently online, that you already have been performing online, these courses will continue this Monday and throughout the next 2-week period without any cessation or interruption. In other words, for courses currently online, it's business as usual. If you're giving an online lecture yesterday or today, then you'll continue Monday and throughout the rest of the period of time as usual. With the exception of current online course offerings, student instruction will cease during this 2-week period. This will give our faculty time to transform their in-person classes to fully online offerings. Now, having said that, we realize that AU is in a very unique position because it is a very unique institution. We are the state's only public health science, medical, and dental school, and we know that makes us very unique. If you are in these disciplines, please work closely with your deans if there are issues that you believe make it difficult to transform course offerings to online, or that make it impossible for you to cease education during this 2-week period. I just left a meeting with your deans in these colleges that offer clinical courses. They're going to be working with the provost. We're going to be working directly with the University System of Georgia to see how we can deal with those unique courses that require students to have patient contact, or because of their cohort lockstep progression, we don't want to interfere with that. So if you're in those disciplines, you should be getting guidance in that as soon as possible. This is very important. And we know this is going to cause disruption, it's going to cause confusion, it's going to cause a little bit of a heartache. But we want to do everything in our power to hold our students harmless regarding their education experience. And we would do everything in our power to ensure that every student receives the academic experience that will allow them to achieve full credit for their particular courses, regardless of the venue, regardless of the method, to deliver that education. That is our promise and a commitment to you. We're going to work with our students to make sure that they can continue their education even under these most unusual circumstances. We're asking our faculty and college administrators to be flexible and be creative in delivering educational experiences for our students. We also ask that our faculty be mindful that their individual students' capabilities to successfully complete online or even distance education are different, and to please be cognizant of home bandwidth issues, of home computer capabilities, etc. You may have to resort to old-fashioned teleconferencing, picking up the telephone to achieve your course requirements. Again, use your expertise, be creative, help your students be successful in whatever way you have to do it, and be mindful that not all students have the capability to do state-of-the-art online education or prepared for online education. So we're going to have to be patient with each other. We're going to have to be patient with our students. And I'm excited to see how our faculty are going to be able to use their incredible talents to make this possible. We have already canceled several study abroad programs, and we ask students and faculty to watch for more updates on this as we move forward. We are the provost in her office, even as we speak, or looking at study abroad programs, and we are tackling those that are the most recent to us, and we'll be getting word out to you as soon as possible about whether those programs will continue. So now let's move to student and housing. We know we have a lot of our students that are housed on campus, and we want to be mindful of that. Students are asked to depart campus by close of business today, Friday, and to remain away from campus until March 29th. We are not asking students to move out of their dorms, but they should take with them whatever they need to continue their studies remotely. Leave your TVs in the dorms. Take your book bags, okay? Leave your dorm stuff there. Take with you home things you might need for the next 2 weeks, and things that you might need to continue their studies remotely if we deem that necessary. We realize that some students may not be able to move out for a variety of reasons. These students will be allowed to stay in their dorms, but we ask you to please get with Student Affairs if you need to stay in your dorms for any reason. Students who are on work study will be allowed to stay and to continue their work. We realize that some students, this is their only source of income. It's very, very important that we maintain this and allow these students to continue to make this income and continue their work. And we will make provisions for you to stay on campus so that you can do so. Federal work students will also be allowed to continue their work. We've already gotten information federally that will allow us to do that. If you're employed in town and you really believe that you need to stay here and you can't afford to take off and go home or other location for a 2-week period, please get with Student Affairs to discuss these possibilities. We'll work with you however we can, try to make it convenient for you to stay. But the goal here is to get our students away from campus and get them home. If you're a PhD or a doctoral student or a graduate student, you'll be allowed to continue to research if needed. We know how important that is to your study and your students too, and we want to hold you harmless as well. So please know that if you need to stay here and continue that, do so. But we encourage you to use flexible scheduling. We encourage your mentors to work with you on flexible scheduling or remote study and remote research if that's at all possible. For those students who will be required to remain on campus for whatever reason, Student Services is already working to ensure that you have access to food and dining and other needs that you have. I've already spoken with our Chief of Police and his folks, and if we have only 1 or 2 students on the floor, we're going to make sure that you feel safe, that you're attended to, and that you can have as productive as experience here as you need to. As it stands right now, all of this is subject to change. And I think we all have to be willing to be flexible and understand that this is a very dynamic and very fluid situation. Our originally scheduled spring break will be continued as planned. That's several weeks off, as you know. We're planning to go ahead and take spring break at that time. Trying to change that. We feel at this point would be too disruptive, but that's also subject to change. Please stay tuned for updates on this particular issue. Students, please stay in contact with us. Go to the augusta.edu website. Look for updates. We're going to be trying to contact you with emails and texts and phone calls. And if you haven't received information from us, pick up the phone and call your department. Call your faculty. You know many of your faculty personally. They want to make sure that you're safe and that you get everything that you need. Now let's move on to employees, because we're also asking that our employees help with this social distancing a concept that the governor's asked us to do. Regarding our employees, we're asking for all supervisors to work with their employees to allow for teleworking options, and we're also asking you to be creative in finding ways for social distancing our employees. For those employees who are working from home as a viable option, we want to ask you to arrange for telework opportunities and ask our supervisors to help employees arrange these. We want to have you look at flexible scheduling as a potential option, and that should also be explored whenever possible. We are going to try to give our supervisors as much leeway as possible and give you as much flexibility on how you document both telework and flexible scheduling. We do not want to overburden you with paperwork, but we do ask you to document how you're dealing with your employees, what you're having them do on the telework situation. If you're doing flexible scheduling, how you document that is up to you. You keep that documentation, and we'll worry about pulling it all together at another point. We want to give you as much flexibility as possible. It is very important that we pay attention, special attention to our hourly workers, our hourly employees, especially those whose job duties do not lend themselves to telework or flexible scheduling. I am depending on all of our supervisors, and indeed this entire enterprise, to find ways for these employees to maintain their work hours and schedules so that no interruption in pay occurs. Be creative. Let's work on ways to share employees where we can. If you have a department or 3 or 4 departments within a college, and you can do flexible scheduling, and you need someone present physically to answer the phones and take care of business continuity, then let one person from a department on Monday work, the next person from another department on Tuesday work. Share employees. Let's find creative ways to allow our employees to telework, but yet still keep business working. So supervisors, please use your professional judgment to allow for social distancing while at the same time maintaining business continuity. Although our scheduling may be flexible during the next 2 weeks, we are still open for business in every way, shape, form, and fashion, and in every sense of the word. Please contact Human Resources if you have questions regarding these issues. We're going to be putting more information out for you, frequently asked questions. If you can't find anything, you just don't know, pick up the phone and call someone from HR. We got one of the best human resource departments in the country, bar none, and they are dedicated to help you and to help you help your employees through this time. There have been a lot of questions about our employees' health, especially employees at the health system that have contact with patients, or employees that may become ill during this period of time. For employees who are subject to high risk of illness or exposure to COVID-19, the coronavirus, or who may be caring for an ill member of their household, institutions have been asked to allow for flexible utilization of leave. All available leave will be allowed for COVID-19 illness or to minimize exposure for those that are high risk and unable to telework. At the point that all accumulated leave has been exhausted, employees will have access to an institutional shared sick leave pool. If the institution's pool becomes depleted, a special enrollment period may be initiated to accept additional program participants and leave donations. Employees who exhaust their paid leave options may be able to request authorized leave without pay in order to take care of themselves or their community without negatively impacting their continued participation in their USG insurance plan. FMLA leave may be available or will be available to eligible employees who contract COVID-19 or who are caring for a qualified family member that has contracted COVID-19. Finally, please ensure that your employees know that it is imperative that they stay home if they are ill or if a member of their household is ill. We want to work with you. We know this is confusing. We know this is hard. We're going to work with our employees to the very best of our ability to make sure that you are able to take care of yourself or of a family member if anyone in your household becomes ill. Please contact HR if you have any questions regarding these issues that require you to take leave. We'll do all we can to accommodate you. Finally, while the current guidance is to temporarily suspend instruction and for flexible employee scheduling for the next 2 weeks, this is a continuing, evolving, dynamic, and fluid situation. Please stay engaged and please stay informed. Visit the Augusta.edu website frequently for updates. Our promise from the President's office is to not overburden you with information, but not leave you hanging, not knowing what's going on. We will try to get information to you in the most effective ways possible and in the most timely ways possible. But when all else fails, go to the Augusta.edu website. We promise to do everything we can to keep you informed. These are very trying and uncertain times, but Jaguar Nation is strong, and our commitment to our students and our patients is enduring. By definition, Augusta University is composed of some of the smartest and most caring people on the planet. And I know you will all continue to do what you have always done, ensuring that we continue to provide the greatest educational opportunities for our students and the most compassionate, state-of-the-art care for our patients. We will continue to be over-prepared so that none of us will have to overreact. And the best takeaway I can give you is as simple as it sounds, is stay calm and wash your hands. Thank you very much for your attention. Thank you very much for giving me the opportunity to spend a little time with you. As I've said, my promise to you is we're going to do our very best to keep you informed. And I know you'll be patient with us. I know you'll be patient with our great state and our governor and our system as we, as a family, get through this particular issue. Wish you all the very best. Thank you for what you do, and go Jags.